Joe Farber. I grew up in Grand Rapids. I went to Grand Valley for undergrad. I went to Loyola in Chicago for medical school. I did my orthopedic training at Henry Ford in Detroit, and I finished with a fellowship in Houston, where I covered a bunch of different professional teams. They did the Houston Astros, the Houston Texans. We covered Rice and the Rockets. So I've always been into sports. Played football in college. So I've always kind of been drawn to the sports side of life in general. I found sort of what I really like to do is taking care of athletes or people that are very active. And orthopedics for me, I never really thought I was going to be a surgeon, but I was really drawn to orthopedics. I really like the surgeries. I really like taking care of that type of patient. And I feel like you really make a difference with people. Maybe you don't save as many lives as other doctors, but you really improve quality of life. Whether it's a knee or an ankle or a shoulder, just being able to get along throughout your day and whatever you like to do and not have a painful, whatever joint. So yeah, I don't know, I think that I like taking care of a broad spectrum of patients, whether it's an aging athlete, whether it's the 15-year-old kid who hurt his knee, playing football, or the 17-year-old girl soccer player. So yeah, I've just been drawn to that side of medicine and orthopedics. I also do a lot of total joints because I have a lot of patients that, I did their ACL, when they were in their 30s or 40s, and now it's 10, 12 years later and it's becoming arthritic. So I take care of a lot of those types of people. But specifically to speak to my partners, we have a great relationship where, everybody has sort of their subspecialty, and we aren't selfish about it, I guess. We're not territorial. So if somebody needs a hip scope, I'm setting them up with my patient because I don't do those as much anymore as when I was younger. Whereas a lot of times if somebody has, a bad shoulder instability or multiligamentous knee injury, my partners who may do ACLs don't really want to do those more complex sport cases, and so they, kind of happy to send those folks over to me. And I think we all talk and we communicate well, and that's really important. Otherwise patients can get lost in the shuffle and it can feel sort of like you're just being passed off, and I don't think anybody likes that. I'm making a little difference every day, and I really like what I do. I like taking care of people. I like the interactions that I have, I'm really glad that I chose to practice here, and I've been here 12 years now, and I don't see myself going anywhere because my wife likes it here, I like it here, kids are in school, so yeah, we're part of the community just like anybody else.